So my name is Natalie. I'm one of the outreach dental therapists with Smile Together. We're here today for our Smiles at Sea campaign. I am currently involved with doing mouth cancer checks for Mouth Cancer Action Month. So what's involved is we will be checking both the outside and inside of people's mouths and just looking out for anything that we would class as suspicious. So what we would do is we start from the outside and we would palpate underneath the chin because you've got a large set of lymph nodes that run down your neck and also at the back of your neck. So we just have a little feel, making sure that we're not feeling anything that's uncomfortable, any large swellings. And then from there we'll be looking inside the mouth. So we start from the inside of the lips, the side of the cheeks, looking at the palate, your tongue, but all sides of your tongue, including the sides and the floor of the mouth. And what we are looking for is anything that looks suspicious, so that means any sort of lumps, bumps, colour changes, rather than the healthy pink that we're looking for. It could be red patches, white patches, a combination of the two. And we're just making sure that if we needed to, we could send somebody for a referral. So the process is, for mouth cancer, unfortunately, because it can go unnoticed for quite a long time, it is really important that if we did notice anything, that we send it on a 2-week referral. So that basically means that if we did send that with pictures or x-rays if needed, that they would be seen by a consultant in oral pathology or oral microbiology at one of our hospitals, and they will be seen straight away in that 2 weeks, and they should have a diagnosis. Hopefully it would be nothing, but we can get them on the care path and make sure that they can get the treatment as soon as possible. Unfortunately, when they hear the word cancer, I think that does actually can make some patients uncomfortable, so it's really important that you continuously reassure them, because more cases are not, it's absolutely fine. It could be, they're deficient in something and that's caused an ulcer, or they've got an underlying medical condition that they didn't know about. But fortunately, we have had quite a good response of people still attending the hospital appointments after the 2 weeks. But if they needed one sooner, there is steps that we can do to hopefully get them seen as soon as possible to help with their work and fit in for their care. We also run Help for Homeless pop-ups throughout Cornwall, and at the last one I attended in Camborne, I actually made a couple of referrals for a 2-week referral to be sent off, and he thought he never needed to be seen because he didn't actually have any teeth, and it's just remembering it's actually your soft tissues as well as your hard tissues that will be impacted, and just because he didn't have any teeth, he didn't think that I'd want to see him, and I'm just so grateful that he did. So he got seen in 2 weeks, and luckily everything was fine, but that's not always the case, and I just think it's the best to just get things checked and not be afraid to ask for help if you need it and you want to get that checked out. I would probably say don't Google mouth cancer and different images. The best thing, you're normal, and if it's not normal for you, whether it's an extra lump that you've seen or you think actually it's not healing as well as it used to, the best thing you can do is get checked by your doctor or a local dentist. Everybody has a responsibility to check your mouth. So even if you're in somewhere that you don't live, please just contact a local dentist and say, I found something while I was visiting, can you please check it? They have a responsibility to check that for you. It's just important that even though we say mouth cancer, we are talking about your head and neck. So, including sort of your ears, your nose, your skin, your lips as well. If you notice any changes, if you've got a darkened freckle or something like that, please just get it checked out. It's the best thing you can do.